Ready? Hi, this is Chad Clark, physical therapy, physical therapist, Physical Therapy Connections. And what I wanted to talk to you today, we've been getting a lot of responses from people, is do a video on low back pain. So this is a big subject to try to cover in a few minutes, but I will do my best, as always, to get you the information that will help you with your low back pain. So people that have low back pain, I'm going to again try to keep it as simple as possible. Two quick tests you can do. One of them is if you can get on your hands and knees, rock back and slide your arms forward and see if there's pain. Kind of take notice of where you're tight, where there's pain, if you have pain. And if you do, that's more of what we're going to call a flexed position. So it's almost this simple. If you have pain with flexed positions, try to avoid or decrease the amount that you're sitting or in a flexed position. So if you're doing a lot of work bending and you have to do it for your job or what you like to do each day, make sure at least every 20 minutes you do some opposite extension, whether you do it in standing or you just simply have a chance to lay down and be in an extended position, or just even lay down on your stomach and work on some deep breathing. That will keep your spine in a more neutral to extended position if you have pain with flexion. So the opposite of that is, let's say you do another test and you have your hips down and then you push up with your hands that are at chest level and you have pain with extension. Now it's the opposite. You might want to do some things where you're flexed. So if you stand a lot or you're doing a lot of overhead work, painting or lifting, make sure you take some time to do some flexion movements where you can get in the opposite direction, even do what we call a reverse toe touch, which I won't get all the way into. There's a few different components to that, but something that will flex to take some ease off. That is, again, a very simplistic way of looking at it, but a few hints that'll help you with the flexion extension. Now the spine also has a little bit of rotation and side to side bending. So some quick things you can do is test your side and see if your fingertips can get to your knee level. If one side hurts more than the other, the most simple thing to do is, let's say it hurts when I go to the right, like, oh, I hurt. Let's say you feel it on your left. Do the opposite. Do 5 to 10 times opposite and try to get the hips involved to mobilize the hips to help the lower spine. Most of your problems with your low back are coming from hip tightness. So even though I'm telling you to do motion that looks like you're bending your spine, it's more about bending your hips in the various directions based on where your pain is. So get your hips more mobile to help your low back. Same way with rotation. You could check, rotate left, rotate right. Do that standing as well as seated and see if you have a limitation or pain one side or the other. And again, it's almost as simple. If you have more pain one way, work on the opposite. I know it sounds a little crazy at first, but do some opposite motion so you're moving away from the pain. And then after you do a few sets of 10 repetitions or so, then go back and check, and that should decrease the amount of pain you have. So we covered bending, if you have problems with that. We covered extension, we covered side to side movements, and we covered some rotation. It's a quick overview, but I wanted to at least give you quite a bit in the small amount of time, some quick tests and some things that you can do about that. Like always, give it a try. If you need more suggestions, we have many more videos on that. You can check us out on YouTube, where there's many more videos just like this.